Hi sisters, my name is Mary Philhart and I'm a registered nurse. I've been asked to speak tonight on Hospice by Sister Jensen, and I thought I would share real quickly how I got into hospice. It came after my dad was diagnosed with cancer 8 years ago, and when things took a turn for the worse and he ended up in the hospital. We had the opportunity at the end to take him home for his last 36 hours of life and have him at home with all of his family on hospice. And so it opened my eyes as a registered nurse to a new world that I really enjoyed and I thought would be an interesting opportunity for me to look further into. And so that's how I ultimately got into hospice. As in the last 8 years, I've had the opportunity to speak to large groups, to small groups, teach patients, families, my own employees about hospice. And I'm going to take everything I normally teach them that could take 30, 40 minutes, an hour, and try to shrink that down into a 4 to 5 minute segment tonight. I've chosen the 10 areas and I'm going to speak briefly to each 10 areas. The first being, what is hospice? It is a care for people who have a terminal diagnosis but are no longer seeking aggressive treatment, such as someone with cancer who is no longer wanting chemotherapy, or someone with heart disease who's not a candidate to have surgery on their heart or no longer wants to do any more aggressive treatment. It's also for people with Alzheimer's or dementia, end of life, maybe failing to thrive type diagnoses. And it allows for us to take care of people who no longer want to go back and forth to the doctor or to the hospital, and it actually brings the care to their home or wherever they may live. Number 2, although there is the term of hospice being 6 months or less, that is the term that we use in hospice, but it can be more than that. There are times where it's days or hours, in my dad's case 36 hours. There are times it's weeks, months, and I've even had patients I've taken care of myself that have been on hospice more than 2 years. It's all dependent on how their terminal diagnosis is and what's going on during that time. Number 3, hospice is for patients and for families. This is the one thing that I really love about hospice. It's a very holistic approach. It includes their physical, which is so much of what we think of medicine. It takes care of head to toe. You'll do assessments. You have all of those things that are involved in the physical well-being of a person, but it also looks to their mental, their emotional, and their spiritual well-being. And then beyond that, it looks into the circle of the people around them. So who's helping to take care of them? Their caregivers, their loved ones, anybody, friends, neighbors, everything. There's a lot of people involved in hospice care, where when you're in the hospital, it's often the patient and one other person. Hospice incorporates everybody. So it's a very holistic approach. And what I love about it is all the things that it can provide to families, such as support and resources outside of the home, community resources. We have social workers who help with that. It even allows for families to be able to take a break with things such as respite care. We help the patients set up in places so families can take a break if needed. And then even beyond that is the grief and bereavement support, where if someone is on hospice, for 13 months after the patient passes away, hospice is there for the families, providing bereavement resources and support. Number 4, hospice provides care in whatever setting the patient resides. So that can be a home, it can be an assisted living facility, it can be a nursing home, and in some instances, hospice can even come into a hospital and help support the end of life when they can't leave the hospital. We're doing a lot more of that now with COVID, when people who are COVID positive can't leave the hospital to go home, so hospice comes in to help support the family and do those things. Number 5, hospice is support from an entire medical team. You have a medical director or a physician who is there, learns everything about the patient from head to toe. It's not just what their terminal diagnosis is. So if they're coming on for cancer, we're not just looking at cancer, we're looking at everything that could cause any sort of pain or discomfort to the patient. We're helping to treat and support that. So if they have a UTI, taking care of that. If they've fallen, what do we need to do to support that? So your medical director or your physician, the nurse, the social worker, and a chaplain. All of these people, and a hospice aide and a volunteer usually involved in the care. All of these people help to serve the family and the patient. Number 6, Hospice provides medications, medical supplies, and what we call DME or medical equipment. So they provide all the things necessary to help take care of the patient at the end of life, such as a hospital bed, a shower chair, any medications that are related to that terminal diagnosis. All of these things are brought into their home so you don't have to go out and get them. Number 7, hospice does not hasten the death of the patient. I always like to reiterate this point because a lot of people are scared of hospice and they feel like once someone goes on hospice that's the end, but it's not. It actually, our goal is to help make the most of those last few days, last few months, last few weeks, whatever the case may be. And there are many times in my experience, somebody comes on hospice and because of this holistic approach, they actually live much longer than with people or their physician expected because they have that extra care and support. Number 8, hospice does not mean a person can't change their mind. Someone can choose to go on hospice because they're stopping chemotherapy. Perhaps they get better, something changes, there's a new medication, anything of the sort. They can actually choose to get off hospice and go back to seeking aggressive treatment and then go back to hospice later if that's what they decide. Just like I said earlier, some people start to get better or live longer than expected. Some people will actually improve enough that they graduate, that's what we call it, off hospice, because they're doing so well, and they may live for years beyond that before they come back on hospice. But going on hospice does not mean you have to stay on hospice. You have the right to stop and to go back to seeking aggressive treatment or doing other things. Number 9, this to me is one that a lot of people don't realize, but there are lots of hospice companies all across the nation, and each hospice company offers something different. They all have minimum standards they have to reach, but everyone may have something different, from music therapy, I've seen equine therapy, different amounts of visits they provide. But I always recommend to families, interview. Just as you would look for a doctor, look for the right hospice company for you and interview at least 3 different hospices. Ask them if you can have the nurse come to your home. Get to know what their staff's like so that you know what fits your family and the patient the best. And last, my favorite by far is how beautiful hospice is. People frequently tell me, Mary, that seems so horrible. I couldn't imagine being around death all the time, but it is beautiful. I can't speak to it enough. I've been on both ends of delivering babies and helping deliver. I call it deliver them into God's hands, people into God's hands, and it is tremendous. The veil's always very thin. It's a beautiful experience every single time, and it's such a great opportunity to be able to support people there in the last few moments of their lives. So it's not necessarily hard, it's really just a beautiful experience. And I thought I'd end, I went over my 4 to 5 minutes, but I thought I'd end by sharing a quote from the founder of hospice, Cicely Saunders. This is kind of my mantra when it comes to hospice, and it says, "You matter because you are you, and you matter to the end of your life. We will do all we can to not only help you die peacefully, but also live until you die." And that just speaks so much to what I believe with hospice. It's not just about death. It's about living those last few moments to their fullest. So thank you all, and I hope to get to see you all in person again sometime.